So I'm gonna knock, introduce myself. Hi, my name's Justin. I'm gonna be your nurse for today. Can you just verify your name and date of birth? I'm gonna do that for both the mother and the baby. And explain the procedure. Just gonna be doing a postpartum assessment today. Do you have any questions before we start? No? Good. So I'm gonna provide privacy and perform hand hygiene. So I'm gonna get a general survey first, get a birth history, whether or not the baby was a vaginal birth or a C-section, whether forceps were used. That could have caused some sort of trauma in the baby, just to know that's good. I'm gonna grab the baby's vitals, temperature, pulse, respiration, and blood pressure is gonna be done once at birth, unless needed otherwise. You're gonna get the height, weight, head, and chest circumference. Head circumference is gonna be bigger than the chest. Overall appearance, body alignment's good, symmetrical, muscle tone's good. Whether or not the baby's crying is good to note. I'm gonna check the skin, so note for any milia, erythema, Mongolian spots, birthmarks, anything out of the norm that I can note. For the head, it's symmetrical, normocephalic. I'm gonna palpate the posterior and anterior fontanelles to make sure there's no bulging or concave, no molding, no caput noted, which is just generalized edema, no acephal hematonia noted. For the face, it's symmetrical, aligned properly, no abnormalities. The eyes, I'm gonna look at the iris to see the color. It's usually gray in most babies initially, and then pearls noted as well. Conjunctiva looks good. Conjunctivitis noted. No strabismus noted. Look at the ears; they're well formed. No damage. Aligned with the outer canthus of the eyes. I'm gonna look at the nose. It's symmetrical. Checking for nasal patency. Make sure it's clear. The babies are nose breathers, so it's good to make sure that that's clear. For the mouth, I'm gonna look in the mouth. Note there's no Epstein pearls noted. I'm gonna palpate the heart and soft pellet to make sure both are intact. The neck and clavicle, I'm gonna assess. I'm gonna look to see if the clavicle is potentially broken, out of place, because that could be caused during childbirth. For the chest is symmetrical, no bared chest or concaving. Nipple sizes are normal, no engorgement. Breast buds are noted and measured in millimeters. The breast buds. Listen to the lungs. No adventitious cells noted. Listen to the heart. No murmur noted. You can also be getting the apical heart rate while doing this. It's going to be between 110 to 160. And then the abdomen, no distension or concaving. And you're going to look at the umbilical cord. Note that there's 2 arteries and 1 vein. I'm going to also tape for bowel sounds as well. There should be none if the baby hasn't eaten the first meal. But their first bowel and voiding should be before 24 hours. I'm going to check for meconium, which is the first bowel movement. It's going to be thick, black, and tarry. I'm going to look at the genitalia. So for female, you're going to look at the labia majora and the labia minora. Make sure both are intact. No discharge noted. For the male, I'm going to make sure the meatus is located centrally. And you're going to palpate the scrotum to see if the testes have descended and if there's any rugae noted. And then any voiding patterns. So how often is the baby peeing is important to know. And then you're also going to test the extremities. So equal and bilateral movements, muscle tone's good, range of motion's good, any hip dislocation noted, no clubbing in the feet, fingers and toes are moving properly. Now I'm going to turn the baby over, look at the spine and the back. Vertical columns aligned. Nose spine bifida noted. And then I'm gonna check for anus patency. So I'm gonna rub across to make sure the muscles are working properly and that it's intact. And then reflexes, there's Moro, tonic neck, palmar plantar, rooting, stepping, swallow, sucking, chugging, inspiration, and then Babinski is going to be one of the more important ones, and that is to check for any neurological issues or defects. And then the behavioral state of the baby, whether they're in deep or light sleep, any drowsiness noted, whether they're quiet or active, and then the intensity of their crying is important to note.